Welcome. Today, we're diving into risk assessment strategies for TSE and BSE in the manufacturing of APIs and excipients. I'm Dr. S.K. Singh, and together we'll explore how to identify, evaluate, and manage these risks to ensure safety and quality throughout the production process. Let's get started. Today, we're diving into the risks linked to TSE and BSE. TSE stands for transmissible spongiform encephalopathies, a group of fatal brain disorders caused by abnormal prion proteins. BSE, or mad cow disease, affects cattle and is tied to contaminated animal materials. In pharmaceuticals, this raises concerns about possible contamination in active ingredients, excipients, biological products, cell culture media, and vaccines. Our main goal here is clear: to identify, evaluate, and reduce any theoretical risks of prion contamination. Now let's look at where risk assessment really matters. We're talking about a wide range of products, from APIs and excipients to vaccines, biologics, and medical devices. The goal here is clear: protect patient safety, meet regulatory standards, keep product quality high, and tighten control over the supply chain. This helps prevent prion transmission, which is critical. Regulators expect thorough risk assessments, especially when animal-derived materials, manufacturing aids, raw materials, or process intermediates are involved. It's a vital step in safeguarding both patients and products. Let's talk about the key regulatory requirements that shape our approach. Traceability and source control are essential to ensure every step is transparent and accountable. We evaluate country risks carefully and qualify suppliers thoroughly. Scientific documentation supports our decisions with solid evidence. Globally, regulators expect us to follow international guidelines and standards. For example, the EMA focuses on minimizing TSE risks, while the FDA emphasizes supplier qualification and traceability. The WHO insists on safe sourcing, and the EDQM requires CEP certification. PIC-S and ICH Q9 guide us on risk management and scientific quality. When we look at major risk factors in API and excipient manufacturing, there are several critical parameters to keep in mind. First, the animal species matters. Materials from bovine sources raise higher concerns, as do those from sheep and goats. Then, the tissue source plays a big role. Brain, spinal cord, and eye tissues are considered high risk. The country of origin is important too, especially in relation to BSE status. Manufacturing processes must effectively remove or inactivate prions. Finally, complex supply chains with multiple suppliers make traceability a real challenge. Now, we're moving into the final stages of the risk assessment process. Step 4 focuses on evaluating how well the process reduces prion risks. That's crucial for safety. Then, in Step 5, we assign a final risk category: low, medium, or high. This structured approach builds on the earlier steps, identifying materials, evaluating their sources, and reviewing supplier documentation. Together, these steps form a thorough, scientific method for assessing TSE and BSE risks. Let's take a closer look at how we interpret risk in this example. The total risk score comes from adding up individual risk factors. Here, that adds up to 10. According to our scale, a score between 6 and 10 places the material in the medium risk category. We can see how each factor contributes. The bovine source scores 4, the controlled BSE country 3, and the other factors add smaller amounts. This method helps us make clear, consistent decisions about risk levels. When it comes to managing supplier risk, we start with clear qualification requirements. These include declarations about TSE and BSE, certificates confirming the country of origin, and proof of the animal species involved. We also look for CEP certification and GMP audit reports to ensure quality and compliance. Our audits focus on traceability, change control, segregation of source materials, and strict documentation control. Finally, we prefer suppliers who are certified, come from countries with negligible BSE risk, and have a strong history of GMP compliance. This approach keeps our supply chain safe and reliable. Traceability and documentation are non-negotiable in our industry. Regulators expect full traceability, from the original source animal all the way to the finished product. That means we need supplier declarations, batch records, country of origin info, manufacturing details, and transport logs. This documentation isn't just paperwork. It supports inspections, product registrations, audits, and helps us investigate risks. Remember, under good manufacturing practices, if traceability isn't complete, our risk assessment falls short. It's that simple. When it comes to managing risks in manufacturing, especially with sensitive materials, there are several key approaches we rely on. These include high-temperature treatment, hydrolysis, chemical treatments, filtration, and controlled sourcing. Take gelatin production, for example. It often involves acid treatment, heat sterilization, and filtration to ensure safety. Regulators expect us to show that our processes can theoretically reduce prion risks, which is crucial for maintaining trust and compliance throughout the supply chain. Let's walk through an example calculation for supplier compliance rate. We evaluated 30 suppliers in total. Out of those, 27 had complete TSE documentation. To find the compliance rate, we divide the compliant suppliers by the total number, then multiply by 100. That gives us 90% compliance. This tells us the overall status is good, but there are still a few suppliers who need some follow-up to meet the requirements. When regulatory requirements aren't met, the consequences can be serious. We're talking about warning letters, product rejection, delayed approvals, even audit findings that can limit market access. Common issues include missing declarations, unknown material origins, expired certifications, and unqualified suppliers. Each one represents a gap in compliance, whether it's documentation, traceability, or risk control. These aren't just paperwork problems, they're risks that can slow down or stop products from reaching patients. Staying ahead means understanding these pitfalls and addressing them head-on. Let's talk about CAPA, that's corrective and preventive actions, and how it drives continuous improvement. We see it in action through things like supplier requalification, extra supplier audits, updating documentation, boosting traceability systems, and ongoing personnel training. On the continuous improvement side, we keep an eye on regulatory changes, reassess risks regularly, track supplier performance trends, and conduct internal GMP audits. The goal: to maintain sustainable compliance with TSE and BSE regulations, keeping quality and safety front and center. Let's look at a real example from a supplier audit focused on magnesium stearate. During the audit, we found incomplete documentation about the origin of animal-derived materials. Digging deeper, it turned out the supplier couldn't fully trace the country of origin, and they were using mixed raw materials without an updated TSE declaration. To fix this, we requalified the supplier, secured extra traceability documents, and put a new change control process in place. We also identified an alternative supplier. In the end, the risk dropped, and GMP compliance was restored. As we wrap up, it's clear that a strong TSE and BSE risk assessment strategy is vital. This helps us safely use animal-derived materials in manufacturing, while staying aligned with global regulations. Key elements include scientific risk evaluation, thorough supplier qualification, full traceability, solid documentation, and ongoing GMP oversight. Regulators focus on patient safety, minimizing risk, supply chain transparency, and compliance. These priorities guide everything we do to keep products safe and trustworthy worldwide. Thanks for joining me today. If you want to explore this topic further or have any questions, please don't hesitate to reach out. I appreciate your time and attention, and I look forward to continuing the conversation. Thank you.